Have you ever considered why, despite maintaining a healthy diet, engaging in regular exercise, and adhering to all the right practices, your legs still feel weaker? What could be the reason behind the perception that stairs are becoming steeper? What factors contribute to the increased time it takes to stand up from a chair compared to the past? Is it merely the passage of time? Or could there be an underlying factor subtly inflicting damage? This is a point that may catch you off guard. It's not solely about what you're not accomplishing. You may be engaging in this behavior without fully recognizing its detrimental effects. Many seniors unknowingly commit a common error each day, fully convinced they are making the right decision due to a lifetime of being informed that fruits are healthy, natural, and advantageous. Certainly, the majority are. Nonetheless, there is a reality that often goes unspoken. Not all fruits are suitable for older adults. Some commonly consumed fruits can, over time, lead to weakened legs, increased knee pain, aggravated joint inflammation, and greater difficulty in walking. Fruits that are promoted as healthy could potentially have negative effects on your mobility, balance, and leg strength. As we progress through life, our bodies undergo significant transformations. Circulation may diminish, metabolism can decelerate, and foods that were once advantageous may gradually start to have adverse effects, especially specific fruits. While they might seem harmless and have a pleasant taste, these items are composed of acids, carbohydrates, and various compounds that can influence blood sugar levels, lead to joint inflammation, and diminish leg strength. The situation is particularly concerning as the damage unfolds slowly, often going unnoticed until it manifests as sharp pain in the calves, ongoing discomfort in the thighs, or unexpected tightness after even a short walk. Today, I will discuss the 7 fruits that individuals over 60 should be cautious about, particularly if they aim to safeguard their legs from potential long-term damage, discomfort, and weakness. Although they may seem innocuous, these fruits are not without their risks. After uncovering the truth, your perspective on the fruit bowl will be forever altered. Remain engaged with me throughout this discussion if you prioritize your strength and aim to uphold stable, robust, and pain-free legs. Your body could be poised for this crucial awakening. However, let's pause for a moment before we proceed. Press the subscribe button and activate notifications if your health is a priority. As we uncover insights that often go unspoken, I would like to ascertain your level of support in this matter. If you find this video meaningful, please indicate your agreement by typing 1 in the comment section. If that is not the case, please enter 0. Your voice holds more significance than you may understand. We shall commence with the initial fruit on our list. While it is often lauded for its anti-inflammatory properties, there is evidence suggesting that it may produce contrary effects in the elderly population. Let us engage in a discussion about pineapple. Pineapple, a tropical delight, is renowned for its juicy and refreshing qualities. It has long been acknowledged for its natural anti-inflammatory properties, attributed to the presence of bromelain. However, there is an intriguing twist to consider. Although it is widely thought that pineapple has anti-inflammatory properties, it could actually be an unexpected issue for older adults. Pineapple is known for its strong acids and natural sugars, which can be more problematic than they seem, especially for individuals over 60. Allow me to clarify. With advancing age, the fragility and sensitivity of our blood vessels tend to increase. They have altered their response to increases in sugar levels. While pineapple offers numerous advantages, it also provides a significant amount of natural sugar that enters the bloodstream. What implications does this have for you? It quickly elevates blood glucose levels. The spike has the potential to harm the delicate blood vessels that provide circulation to your legs, feet, and muscles. As circulation declines over time, a reduced amount of oxygen is delivered to your legs. Do you understand the implications of that? Discomfort, exhaustion, inflammation. Following a brief stroll, one may experience a persistent, heavy discomfort in the legs. Prolonged standing can lead to stiffness in the knees. You may experience unexpected ankle pain, even after prolonged periods of sitting. There is additional information to consider. pineapple possesses both acidic and sweet characteristics. The presence of that acid can exacerbate joint irritation, particularly in individuals with pre-existing inflammation or arthritis. It resembles intensifying an existing blaze, already raging in your ankles, hips, and knees. Some individuals report a sensation of heaviness in their legs following the consumption of pineapple, as though their strength is slowly diminishing. It is important to be aware of this information as well. Individuals who are on medications, especially blood thinners, should be aware that the enzyme bromelain can potentially interact with specific drugs, leading to either increased potency or diminished effectiveness. Nevertheless, the most perilous element is this. Pineapple does not exhibit any clear adverse effects. No distinct indicators or acute discomfort are present. Rather, it seeps in slowly until you ultimately come to the realization that your mobility has diminished from what it once was. The most heartbreaking aspect? Many older adults may not be aware that the fruits they consume for health benefits could be linked to the annual decline in leg strength they encounter. What are your capabilities? It is not necessary to eliminate pineapple from your diet entirely. However, moderation is key, particularly if you are dealing with ongoing leg pain or unexplained swelling. The harm may be understated, yet it is undeniably present. Considering the anti-inflammatory properties of pineapple, one must ponder the potential effects it may have on aging legs. What implications might the next fruit hold? It possesses a tender texture and delightful flavor, recognized for enhancing muscle strength and elevating potassium levels. However, it could be misleading. Let us engage in a detailed discussion about bananas. Bananas are a remarkable food choice, characterized by their soft texture, sweet flavor, and impressive potassium content. These substances are recognized for their ability to enhance energy levels, mitigate cramps, and support muscle function. However, for older adults, the circumstances are distinct. Bananas are rich in natural sugars and feature rapidly digestible carbohydrates. Following a meal, there is an immediate increase in your blood sugar levels, which triggers your body to start developing insulin resistance. When this occurs consistently, circulation diminishes, inflammation escalates, and your legs endure the consequences. It is common to encounter a sensation of dull soreness during activities such as walking or ascending stairs, along with a feeling of heaviness in the legs following meals and stiffness in the calves. However, there is more to consider. Bananas can lead to heightened fluid retention, particularly in individuals with heart conditions. This results in rigid joints, inflamed feet, and swollen ankles. The impact is subtle. Your conviction that bananas support muscle health leads you to incorporate them into your diet. Rather, they could be slowly undermining your vitality. The most challenging aspect? Initially, you may not notice any changes, but with time, the consumption of bananas could lead to more challenging movement and heightened discomfort. Take a moment to evaluate the fruits on your plate if you often find yourself dealing with heavy, aching, or swollen legs. While bananas might seem benign at first glance, one must consider the potential impact of even smaller entities that could elicit similar effects. Bananas are recognized for their role in muscle support. Delicate, appealing, and seemingly harmless, the next fruit we discuss could be the culprit behind your joint discomfort. Let us engage in a detailed discussion about grapes. Grapes present themselves as delightful, small, succulent morsels that are effortlessly enjoyable as a snack. They possess a remarkable reputation, promote heart health, and are rich in antioxidants. It is important to note that many individuals may not be aware that older adults can experience mild leg pain, stiffness, and inflammation as a result of consuming grapes. What is the reason behind this? Grapes contain fructose, a substance that can be harmful in elevated concentrations. This sugar is directly absorbed by the liver, where it is converted into fat and acid. When the liver is unable to fully process substances, significant damage can start to occur, especially in the toes, ankles, and knees. The accumulation of uric acid in the joints leads to episodes of burning, aching, and swelling sensations. The persistent discomfort renders even gentle walking challenging. Have you encountered sharp discomfort in your big toe during the night? Experiencing sudden stiffness in your calves? A mere handful of grapes has the potential to elevate your uric acid levels significantly. Moreover, fructose contributes to the persistence of chronic inflammation within the body. This indicates a reduction in mobility, heightened pressure, and a sense of rigidity. Grapes can be quite simple to consume in excess. They are sufficiently petite to allow for continuous nibbling. Before you know it, you've ingested 2 or 3 cups, and the sugar content escalates rapidly. Although grapes may appear to be a nutritious choice for a snack, they can gradually diminish strength, decrease flexibility, and lead to discomfort in your legs as you grow older. Now you are aware of what could be concealed beneath that sweetness. If you have been regularly consuming grapes and are noticing a rise in stiffness and swelling, it may be worth exploring this potential link. However, there are additional delectable fruits that may pose risks. Another is rich, lively, and renowned for its hydrating properties. Exercise caution and remain discerning. Internally, it operates similarly to sugar, despite having a flavor profile akin to water. Let us engage in a detailed discussion about watermelon. Watermelon is a fascinating fruit, known for its refreshing taste and high water content. It belongs to the cucurbitaceae family and is often enjoyed in various culinary applications, from salads to smoothies. Illumination. Invigorating. A quintessential representation of hydration and the essence of summer. Is this hydrating fruit subtly harming your legs? It's quite peculiar, wouldn't you agree? It is widely acknowledged that watermelon serves as an exceptional source of hydration. It provides a sense of security, contains minimal calories, and is predominantly composed of water. Here is the key insight, however. Watermelon possesses a notably elevated glycemic index. This indicates that it elevates blood sugar levels quickly, similar to the effect of candy. The frequent spikes in sugar levels can lead to considerable damage in seniors, especially affecting their legs. Allow me to clarify the details. Upon a rapid increase in blood sugar levels, the body responds by releasing insulin. Insulin regulation tends to decline in older individuals. This leads to inflammation, particularly in regions where circulation is insufficient. In what location can this be found? The lower leg, including the calves, ankles, and knees. It is common to encounter leg fatigue shortly after meals, experience a dull ache during brisk walks, and notice ongoing swelling around the ankles. Ascending stairs begins to resemble the challenge of conquering a mountain. Watermelon presents a delicate texture, yet within, it functions as an intriguing allure, subtly diminishing your legs over time. Many individuals indulge in substantial amounts due to its appealing juiciness and refreshing qualities. One slice transforms into 2, then 3, leading to heightened sugar levels, amplified stress, and increased inflammation. It can be quite misleading. What you perceive as hydration may actually lead to elevated blood sugar levels, compromised circulation, and discomfort in your legs as a consequence. Is watermelon effective in aiding hydration for seniors? Or does each gradually heighten the discomfort associated with movement? It may be prudent to evaluate your regular consumption of watermelon, especially if you've noticed an increase in leg fatigue recently. Let us transition to a fruit renowned for its vitamin C content and health benefits. It is a common ingredient found in juices, immunity-boosting beverages, and breakfast options. Nonetheless, older adults might encounter an acidic assault on their joints. Let us engage in a detailed discussion about oranges. Oranges are a fascinating fruit, known for their vibrant color and refreshing taste. They are rich in vitamin C and have a variety of uses in culinary applications. From juices to desserts, their cultivation and varieties also present interesting aspects for agricultural study. These items are vibrant, aromatic, and found everywhere in beverages, nutritional supplements, and morning meals. It is widely recognized that they enhance immune function due to their vitamin C content. Nonetheless, oranges could conceal a troubling reality for older adults, especially those aged 60 and above. Within that citrus radiance lies acidity, which is not favored by your joints. Oranges are abundant in citrus content. Although this may appear typical, it can lead to subtle joint irritation, particularly if your body is already contending with inflammation, stiffness, or arthritis. It is common to encounter gradual morning stiffness in the knees, persistent hip pain, discomfort in the legs following extended periods of sitting, reduced mobility, and heightened swelling. One might conclude that it is merely a result of the aging process. It is important to recognize that the seemingly beneficial routine of consuming orange juice each morning may actually be linked to the discomfort you are attempting to avoid. Let me explain the process that unfolds. The citric acid found in oranges has implications that extend beyond mere digestive effects. It infiltrates your bloodstream and has the potential to exacerbate the sensitive tissues surrounding your joints. Moreover, when paired with the inherent sugars found in the fruit, it leads to variations in blood sugar levels. The outcome? Systemic inflammation present in the body. The sensation of each step becomes increasingly burdensome and uncomfortable as inflammation radiates through your knees, ankles, and calves. It is important to note that oranges generally do not pose any harm to younger individuals. However, in older adults with aging joints and reduced circulation, the effect manifests gradually. The most challenging aspect is that you partake in them under the impression that you are engaging in a healthful practice, given the long-standing association of oranges with well-being. However, it's important to recognize that they may not be contributing positively to your well-being. What are the upcoming steps? This fruit appears pristine, vibrant green, and crisp, with a reduced sugar content. It is widely regarded as the most secure choice. Nonetheless, it conceals an issue that may lead to nighttime cramping, tightness in the knees, and discomfort in the hips. Let us engage in a discussion about green apples. Green apples exhibit a refreshing crispness, embodying a sense of cleanliness and authenticity. Many individuals, particularly older adults, perceive these options as healthier due to their less sweet flavor profile. These appear to be a nutritious option with minimal sugar content. It is important to note that green apples can, in some cases, lead to feelings of fatigue, stiffness, and leg pain that may not be immediately recognized by many individuals. Two factors present a risk: malic acid and concealed natural sugars. To begin, we should examine malic acid in detail. This acid is responsible for imparting the characteristic sour flavor found in green apples. Although it may be beneficial for younger individuals, it can pose challenges for those with aging digestive systems. As we age, the sensitivity of our gut lining increases, and malic acid has the potential to irritate various tissues, including joints, once it is absorbed into the body. Following the consumption of apples, certain elderly individuals may encounter significant discomfort in the hip or thigh regions. Some individuals experience a slight warmth in their feet or a sensation of tightness in their knees. The condition progresses slowly, yet as time passes, the acid builds up, leading to an increase in pain episodes. Let's discuss the sugar. Green apples possess natural sugars, despite their less sweet flavor compared to red varieties. Sugar can lead to fluctuations in blood sugar levels among older adults who have slower metabolic rates. It is possible to encounter symptoms such as fatigued calves, nocturnal leg cramps, morning stiffness, or a sense of weakness while ascending stairs. The primary challenge lies in the fact that green apples are frequently eaten raw, as a snack, or even just before bedtime, which consistently impacts the body. While they may seem vibrant and wholesome, green apples could be quietly contributing to increased difficulty in walking, joint stiffness, and more restless evenings for those in their later years. What can be said about a tropical fruit that is rich and exceptionally sweet? If something as fundamental as an apple can yield such results, what can be said about the fruit that is cherished by so many? Let us delve into the intricacies of the mango, often regarded as a significant source of sugar. The mango is exceptionally juicy and soft, reminiscent of candy in its delightful sweetness. This fruit is widely appreciated, especially in the warmer summer months. The reality is, however, Mango could potentially be the most detrimental fruit for older adults dealing with joint weakness and leg pain. What is the reason behind this? Due to its high concentration of natural sugars. A substantial surge of sugar that leads to a rapid and pronounced increase in blood sugar levels. If you maintain an active lifestyle and are under the age of 30, your body is generally capable of managing that increase effectively. Nonetheless, following the age of 60, there are notable changes in your metabolism. The consumption of sugar leads to a rapid increase in insulin levels, which is subsequently followed by a decline in energy levels. Whenever this happens, your body generates inflammation deep within the joints, especially affecting the soft tissues around the ankles, hips, and knees. Nerve issues can manifest in various ways, including burning sensations in the toes, persistent tingling, evening swelling around the feet, or a creeping heaviness in the legs. The light taste and fresh feel of mango can lead to the consumption of larger portions, which can exacerbate the situation. That is the key element. The experience of lightness holds no significance for your body. The sugar initiates a response, and over time, this sugar can lead to joint pain, a sluggish gait, and unsteady legs. A significant number of seniors consume mangoes under the impression that they are a wholesome option. While it may be a natural choice, one must recognize that natural does not inherently guarantee safety, particularly for those with compromised circulation and aging joints. You now have a comprehensive understanding of the situation. While these 7 fruits are often praised for their health advantages, they also present certain drawbacks for individuals over the age of 60. Allow me to share some positive developments. Certain fruits can produce contrasting effects. They enhance leg strength and stability, alleviate joint discomfort, and combat inflammation effectively. Let's explore the various therapeutic alternatives and the dietary options that are more suitable for seniors. Having identified the fruits to steer clear of, it's time to explore the options available for your diet. Consuming the appropriate fruits transcends mere hunger satisfaction. They facilitate the healing process of your body. To begin, we should discuss berries. Blackberries, raspberries, blueberries, and other similar fruits. These small fruits serve as potent agents against inflammation. These foods are beneficial for maintaining stable blood sugar levels, rich in antioxidants, and contain minimal sugar content. Primarily, they enhance blood flow, especially in the lower extremities. These solutions enhance mobility, alleviate stiffness, and minimize swelling. Following that, consider cherries, but be sure to enjoy them in moderation. Cherries have been shown to effectively lower uric acid levels, which can significantly decrease the risk of gout and alleviate joint pain flare-ups. These products effectively alleviate discomfort in sore joints and provide relief from burning sensations in the knees or toes. A small quantity of cherries can offer considerable relief. Next in line is the avocado. Indeed, it is classified as a fruit and is among the top choices for promoting joint health. What is the reason behind this? This substance is rich in advantageous fats that effectively diminish internal inflammation and provide support to your joints. Furthermore, it plays a crucial role in insulin regulation, ensuring a consistent energy supply while preventing blood sugar spikes and drops. Are you in search of something that is simple to consume? Consider incorporating papaya into your diet. This exquisite tropical fruit is rich in enzymes that effectively diminish inflammation and support digestive health. It provides a soothing effect on aging joints and is gentle on the digestive system. Additionally, keep in mind the importance of pears. Incorporate them alongside a modest quantity of fiber or protein. They offer a delicate sweetness that avoids overwhelming the palate. They invigorate your body while minimizing strain on your legs. Every one of these fruits enhances your body's functions instead of hindering them. There is no discomfort or swelling associated with them. They assist your body in attaining the vitality, equilibrium, and tranquility it desires. Keep in mind that the focus extends beyond merely consuming fruit. It involves choosing the most suitable options based on your age. Fruits that are ideal for your body at this moment. You will certainly notice the impact of making those intentional decisions. More decisive strides, fluid motions, and brighter beginnings. In closing, I would like to share some insightful thoughts and a tailored message just for you. Your continued engagement with this content indicates a genuine concern for your future, well-being, and overall strength. I want you to understand this distinctly. There is still an opportunity for you to make a transformation. There is still an opportunity for you to make a comeback. You are certainly not isolated in this situation. The process of aging presents significant challenges. The onset of pain, stiffness, and the apprehension of falling can occur progressively, often leading to a sensation of one's body fading away. The reality is as follows. It is advisable to exercise control through prudent, measured changes instead of resorting to drastic actions. One meal, one fruit, and one decision at a time is the approach to take. The fruits we examine today are not necessarily detrimental, but they may not be the most beneficial choice for your health at this time. Aging is a natural process, and it certainly does not equate to surrendering one's ambitions or vitality. It's about enhancing one's intelligence. As you embark on the journey of mindful eating and choose foods that enhance strength, circulation, and joint health, you will undoubtedly observe a significant transformation. Reduced discomfort, enhanced mobility, more seamless mornings, and a lighter gait. Our objective is to foster an environment free from fear and limitation. I am eager to hear your insights. Share your insights from today and the adjustments you are ready to implement in the comment section. Collaboration fosters growth, so let us support one another. If you found this video beneficial or gained any new insights, kindly consider clicking the like button. Subscribe to guarantee you stay informed about vital information that has the potential to enhance your health. Ensure that notifications are activated prior to your departure. If you found this video beneficial, kindly indicate by typing 1. In the absence of an alternative, please enter 0. Your input holds greater significance than you might think. Maintain your strength and awareness, and always remember that your legs are the foundation of your autonomy. It may come as a surprise, but certain fruits have the potential to negatively impact your health from within. Recent research indicates that these beverages may pose greater risks than soda for individuals aged 65 and older. A recent study published in the Journal of Clinical Nutrition reveals that older adults who frequently consumed specific healthy fruits faced a remarkable 57% increased risk of developing metabolic syndrome, a condition closely associated with serious health issues such as stroke, diabetes, and heart failure. What is genuinely concerning? These seemingly innocuous fruits are prominently featured as superfoods and health essentials, yet they may be quietly harming your organs over time. For individuals over 65, the slower metabolism, heightened vulnerability of cells, and significantly reduced sugar tolerance can lead to serious consequences. The detrimental effects of these fruits can inflict irreversible damage long before any symptoms become apparent. However, there is a crucial insight that remains undisclosed. Some overlooked fruits serve as natural remedies for the aging body. They significantly reduce blood pressure, enhance cardiac function, and effectively reverse cognitive decline associated with aging. This exclusive video reveals the 4 essential fruits that seniors should incorporate into their daily diet, as well as the 4 harmful fruits they need to steer clear of completely. You'll be surprised to discover which fruit tops our danger list. This widely enjoyed confection, cherished by countless individuals, may be subtly depleting your energy and diminishing your life expectancy. Before we proceed, please share in the comments where you're tuning in from. Also, remember to like this crucial video and subscribe to our channel for more eye-opening health insights. It's time to reveal the reality that has been concealed from your view. 4th on the list, we have avocados. Indeed, avocado is classified as a fruit, and it warrants particular attention due to its potential to significantly enhance your health. In contrast to years of misguided nutritional guidance that demonized all fats, avocados stand out as one of the most beneficial healing foods that seniors can incorporate into their diets. The avocado stands out due to its exceptional levels of monounsaturated fats, particularly oleic acid. Clinical research has demonstrated that it significantly lowers harmful LDL cholesterol levels, while enhancing beneficial HDL levels. The specific fat composition of avocados renders them exceptionally beneficial for older adults facing cardiovascular issues, as these enhanced ratios lead to significant decreases in the risk of heart attacks and strokes. However, there are certain insights that may not be fully conveyed by your healthcare provider. Many seniors may not be aware that avocados are a rich source of potassium, offering around 975 milligrams per fruit. This makes them particularly beneficial for managing blood pressure levels, which is crucial given that hypertension quietly impacts nearly 2/3 of adults over the age of 65. The potassium found in avocados effectively counteracts sodium consumption and promotes the natural relaxation of blood vessel walls, leading to improved blood pressure levels without the need for extra prescription medications. However, there's additional information to consider. In addition to their cardiovascular advantages, avocados are rich in lutein, a potent antioxidant carotenoid known for its significant role in enhancing eye health and mitigating the advancement of age-related macular degeneration, which is the primary cause of vision impairment in older adults. One of the most remarkable advantages of avocados lies in their exceptional capacity to enhance nutrient absorption. Numerous vital vitamins and antioxidants found in vegetables, such as vitamins D, E, and K, are fat-soluble, indicating that your body requires fat for their absorption. Incorporating avocado with your vegetables or cooked greens can significantly enhance the absorption of essential nutrients, potentially increasing it by as much as 15 times. This represents a groundbreaking advancement for individuals seeking optimal advantages without the need for countless supplements. What are the steps to access these transformative advantages? Consuming just 1/2 of an avocado daily can significantly enhance your health. Apply it generously on whole grain toast. Incorporate it into a protein smoothie for enhanced nutrition, or savor it directly with a spoon, complemented by a hint of lemon. This remarkable fruit is undeniably transformative when it comes to enhancing your longevity and overall health. Is it possible that we have overlooked the key to longevity right before our eyes? Apples are notably abundant in a unique fiber known as pectin, which plays a crucial role in supporting the beneficial bacteria within your gut. A healthier gut microbiome significantly enhances digestion, boosts immunity, and improves nutrient absorption. 3 essential elements that grow more important with age. What sets apples apart is their significant influence on cholesterol levels and their role in heart protection. Pectin plays a crucial role in binding harmful cholesterol within the digestive system, facilitating its removal from the body and leading to a significant reduction in dangerous LDL cholesterol levels over time. Apples are rich in potent flavonoids such as quercetin, which play a significant role in reducing chronic inflammation and greatly enhancing cardiovascular health. What is truly captivating is this: apples, while naturally sweet, exhibit a remarkably low glycemic load. Their unique fiber structure effectively slows the absorption of sugar into the bloodstream, thereby averting the harmful spikes and crashes that can significantly impact the health of seniors dealing with insulin resistance or type 2 diabetes. The impact of this protective effect can be transformative. Apples possess a remarkable ability to satiate due to their optimal blend of fiber and water content, positioning them as an excellent choice for natural appetite regulation and effective weight management. However, there is a surprising fact that many professionals in the health field tend to overlook. Consuming apples regularly promotes essential saliva production, which plays a crucial role in lowering the risk of cavities and gum disease, issues that can become more damaging as one ages. Is it possible that a single apple each day can genuinely prevent the need for a doctor's visit? What additional mysteries could this ubiquitous fruit be concealing? Secondly, we have the pomegranate. Envision a fruit with the remarkable ability to revolutionize your cardiovascular health. Pomegranate might not be the most obvious choice for everyday intake, yet for older adults, this vibrant red fruit serves as a remarkable asset for heart health as we age. With advancing age, it is common for arteries to undergo a process of stiffening and hardening, which can impede essential blood flow, increase blood pressure to hazardous levels, and impose significant stress on the heart. The pomegranate stands out due to its unique provision of punic allergens, a rare form of antioxidant that has been shown in pioneering research published in the esteemed journal Atherosclerosis to significantly lower arterial oxidative stress by more than 30%. Clinical research demonstrates that these compounds provide up to 3 times the antioxidant activity found in red wine or green tea. The accumulation of oxidative stress leads to inflammation and narrowing of the arterial walls, akin to the corrosion of an old water pipe by rust. However, punic allergens effectively eliminate these harmful compounds, resulting in significantly smoother and more effortless blood flow. Pomegranate juice has demonstrated clinical efficacy in reducing systolic blood pressure by an impressive 5 to 21% in individuals with hypertension. This represents a significant advancement for older adults seeking to control their blood pressure, while minimizing reliance on additional medications. The advantages reach well beyond just cardiovascular well-being. Pomegranate significantly enhances memory and brain function. A groundbreaking study conducted at UCLA revealed that older adults who incorporated pomegranate juice into their daily routine exhibited notable enhancements in verbal memory assessments when compared to their counterparts who did not partake in this beverage. This discovery holds significant importance as memory loss continues to be one of the most dreaded and impactful consequences of aging. Pomegranate juice offers many of the same impressive advantages for seniors facing dental challenges, all without the need for chewing. Concentrated antioxidants in supplement form have demonstrated encouraging outcomes. However, consuming whole fruits offers extra fiber and vital micronutrients. Here's a crucial insight that many medical professionals may not openly share. It is not necessary to intake substantial amounts on a daily basis. Simply savoring a half cup of the seeds or adding a splash of pure juice to your daily regimen can yield remarkable advantages. Pomegranate stands out among many fruits that may seem sugary, as it boasts a low glycemic index. This characteristic ensures that it does not provoke harmful blood sugar spikes, which can contribute to the aging process. This is crucial for older adults dealing with prediabetes or type 2 diabetes. It is essential to choose pomegranate juice that is entirely pure, free from any concealed added sugars. It is essential to consult your doctor before incorporating pomegranate into your diet if you are on blood thinners, as it may interact with specific medications. We must inquire about the factors that contribute to the exceptional potency of this ancient fruit for aging bodies. What are the reasons that not every senior is incorporating it into their daily routine? First and foremost, we have berries: blueberries, raspberries, and blackberries. Leading our selection of fruits that promote longevity for older adults are these exceptional berries: blueberries, raspberries, and blackberries. Together, they offer some of the most impressive age-defying benefits found in natural foods. The unique transformative qualities of berries for seniors lie in their significant effects on cognitive function and brain rejuvenation. These remarkable fruits are rich in anthocyanins, the unique plant compounds that not only provide blueberries with their striking hue, but also serve as potent protectors for the nervous system. Regular consumption of these compounds leads to a significant reduction in brain inflammation and markedly improves communication between brain cells. Recent groundbreaking research featured in the esteemed journal Annals of Neurology has revealed that older adults who included merely 2 servings of blueberries in their weekly diet demonstrated significant delays in cognitive aging, potentially extending their cognitive health by as much as 2.5 years. This indicates that they effectively preserved the cognitive abilities typical of a much younger individual. The protective effect on the brain is evidently associated with the distinctive capacity of berries to traverse the essential blood-brain barrier, effectively neutralizing oxidative damage in brain tissues prior to the onset of irreversible harm. The advantages reach well beyond mere cognitive safeguarding. Berries play a crucial role in enhancing balance and coordination, which is essential for preventing falls, one of the primary causes of serious injuries in older adults. The cardiovascular advantages of incorporating berries into one's diet are noteworthy, as numerous clinical studies have shown substantial decreases in blood pressure, enhanced arterial flexibility, and lower levels of inflammation in older adults who regularly consume these fruits. The observed effects lead to quantifiable decreases in the risk of heart disease, a factor of utmost importance given that heart disease continues to be the primary cause of mortality in the elderly population. In addition to these significant advantages, berries possess remarkable capabilities for managing blood sugar. Their unique fiber and bioactive compounds play a crucial role in stabilizing glucose levels post-meal, effectively preventing the harmful spikes that can worsen diabetes or pre-diabetic conditions frequently observed in older adults. The fiber content in berries, around 8 grams per cup, effectively supports optimal digestive health and encourages regular bowel movements while remaining gentle on sensitive digestive systems. Incorporating just 1 cup daily, whether into oatmeal, yogurt, or a nutrient-dense smoothie, can significantly enhance energy levels, improve mental clarity, and promote mood stability. However, this is the essential aspect that many nutritionists overlook. Opt for fresh or frozen berries, and make it a point to steer clear of dried varieties, as they frequently contain hidden sugars that undermine the health advantages. Having discussed the top 4 miracle fruits that seniors should incorporate into their daily diet, it's time to highlight the 4 hazardous fruits that seniors should avoid at all costs, beginning with one that could be hiding in your kitchen at this very moment. Fourth on the list, we have grapes. Upon initial observation, grapes seem innocuous, perhaps even advantageous. These fruits are compact, delightful, and invigorating, often highlighted for their remarkable antioxidant properties, particularly in the red or black forms. However, the surprising reality is that for older adults, grapes can pose significant risks. One of the significant risks lies in their remarkably high sugar levels, coupled with an almost complete absence of fiber to offer any protective benefits. Grapes possess a high concentration of fructose, and their ease of consumption in large quantities can lead to an unintentional intake of sugar that may be surprisingly excessive. The concerning fact is that a single cup of grapes holds an impressive 23 grams of sugar, which is almost equivalent to that found in a candy bar. For older adults facing challenges with blood sugar management, this situation leads to significant metabolic complications. The lack of fiber allows this sugar to enter the bloodstream swiftly, leading to significant increases in blood glucose and insulin levels. These fluctuations are not just transient. They are intricately connected to accelerated weight gain, systemic inflammation, and a significantly heightened risk of type 2 diabetes. Another significant issue is that grapes often carry pesticide residues when not bought organic, and older adults with compromised immune systems or sensitive digestive systems may be especially at risk from these harmful substances. The skin of grapes, though seemingly harmless and simple to eat, provides limited nutritional advantages when compared to the protective skins found on other fruits such as apples or pears. The surprising reality is that grapes, while seemingly harmless, can pose significant metabolic challenges, particularly for older adults striving to sustain stable energy levels, achieve a healthy weight, and promote long-term metabolic health. Which additional fruits should you steer clear of entirely? Dried fruits are the third item on the list. Dried fruits, especially those that are commercially processed with sulfites, pose significant risks for seniors, despite their seemingly healthy appearance and ease of use. The primary concern with dried fruits is their remarkably high concentration of sugar. The removal of water during the drying process results in a highly concentrated form of fruit sugar. A small handful of dried apricots, for instance, has roughly the same sugar content as several whole fresh apricots. This makes it alarmingly simple to ingest high levels of fructose without the accompanying fiber and water that typically help signal fullness. The concentration of sugar in this context poses significant challenges for older adults dealing with diabetes or insulin resistance, as it has the potential to cause substantial increases in blood glucose levels, even with minimal intake. Over time, this can result in the development of full-blown type 2 diabetes or complicate the management of existing diabetes. but the repercussions extend well beyond mere blood sugar disruption. The elevation of sugar levels significantly contributes to systemic inflammation across the body, potentially exacerbating arthritis pain, hastening cognitive decline, and undermining immune function, issues that are particularly detrimental for seniors. In a surprising discovery, it has come to light that commercially produced dried fruits often include added sulfites, which are preservative chemicals utilized to enhance color and prolong shelf life. Sulfites have the potential to provoke significant asthmatic responses in those who are particularly sensitive. Seniors exhibit heightened vulnerability stemming from age-related alterations in respiratory function, coupled with a greater incidence of asthma and COPD within older demographics. About 1 in 100 individuals experience sulfite sensitivity, a figure that significantly rises among older adults with respiratory issues. The presence of concentrated sugars and chemical preservatives in dried fruits poses significant risks for seniors dealing with inflammatory conditions like arthritis, a condition that impacts nearly 50% of adults over the age of 65. However, there exists an unexpected threat that may be hiding in your fruit bowl. 2. While fully ripened bananas with brown spots can be a nutritious option for many seniors, unripe or green bananas pose several significant health risks that render them one of the least advisable fruit choices for older adults. The main concern regarding unripe bananas is their elevated levels of resistant starch. In contrast to the readily absorbable sugars present in ripe bananas, this particular form of starch demonstrates a notable resistance to digestion within the small intestine. For seniors facing age-related digestive issues, including reduced digestive enzyme production and slower gut motility, this resistant starch may lead to considerable gastrointestinal discomfort, manifesting as painful bloating, gas, and abdominal distress. The issue intensifies notably among older adults experiencing irritable bowel syndrome or inflammatory bowel conditions, which are becoming more prevalent as age increases. The challenges associated with digesting unripe bananas go beyond simple discomfort. It has the potential to hinder the absorption of essential nutrients from other foods ingested in the same meal. This situation is especially concerning for older adults who might already face challenges with nutrient deficiencies stemming from medication interactions, diminished appetite, or age-related declines in nutrient absorption efficiency. It is important to note that the astringent compounds found in unripe bananas, which contribute to their distinctive chalky mouthfeel, can provoke irritation in the lining of the digestive tract for those who are sensitive, potentially leading to inflammatory responses within the gut. From a nutritional standpoint, unripe bananas exhibit markedly reduced levels of beneficial antioxidants when compared to their ripe counterparts, as these essential compounds experience a substantial increase throughout the ripening process. For seniors looking to harness the anti-inflammatory advantages of fruit, the lower antioxidant levels in unripe bananas present a significant risk. However, nothing quite matches the alarming risk associated with our top fruit to steer clear of. 1. At the forefront of our cautionary list, concealed in plain view, is a fruit that may surprise numerous health-aware seniors: grapefruit. While grapefruit is often lauded for its health benefits and role in weight management, it can present serious risks for older adults who are on certain medications. Compounds known as furanocoumarins pose a concealed risk, as they significantly hinder the production of a vital enzyme in the intestine referred to as CYP3A4. This enzyme plays a crucial role in the metabolism of around 85 essential medications. Inhibition of this enzyme can lead to medications accumulating to dangerously high toxic levels in the bloodstream. It is akin to being administered a significantly larger dose than what was intended, despite having consumed the prescribed amount accurately. The potential for serious side effects can significantly escalate, with some outcomes being fatal, contingent upon the specific medication involved. The range of medications impacted is quite broad, encompassing several widely prescribed options for seniors. This includes specific statins for cholesterol management, such as atorvastatin, lovastatin, and simvastatin, as well as essential blood pressure medications like certain calcium channel blockers, including nifedipine. Additionally, it covers anti-anxiety medications like buspirone, anti-arrhythmia agents such as amiodarone, and various common antihistamines and immunosuppressants. In a striking instance, the consumption of grapefruit alongside the statin Lipitor can elevate the drug concentration in the bloodstream by more than 400%, significantly heightening the risk of severe side effects, such as muscle breakdown and kidney failure. What is particularly concerning is that these hazardous interactions can occur without the need to ingest significant quantities of grapefruit. Even a small portion of fruit or a modest glass of juice can be enough to initiate these potentially life-threatening interactions, with effects that may linger for as long as 72 hours post-consumption. Merely spacing out your medication and grapefruit consumption does not remove the associated risks. The potential for interaction is considerable, particularly with numerous common medications essential for managing health conditions in seniors. Therefore, grapefruit ranks as the most critical fruit to either avoid or approach with heightened caution. It is crucial to consult with your doctor or pharmacist regarding the safety of consuming grapefruit or grapefruit juice if you are taking any prescription medication. Do not take safety for granted. The potential for exacerbating the effects or side effects of your medication is a critical concern that must not be overlooked. It appears to be a harmless fruit, yet it harbors the possibility of a dangerously concealed interaction. Thus, we have presented the essential insights regarding the fruits that seniors ought to incorporate into their diets, as well as those that should be avoided without delay. The advantageous fruits such as avocado, apples, pomegranates, and berries have the potential to significantly influence your aging process, improve mental clarity, and greatly fortify your body. However, certain foods such as grapefruit, dried fruits, unripe bananas, and even grapes, which may appear harmless, can stealthily deplete your energy, elevate your blood sugar levels, and heighten inflammation, ultimately jeopardizing your overall health. The most concerning aspect is the subtlety with which these effects can manifest. Many individuals remain unaware that consuming just a few grapes or half a grapefruit can initiate a series of harmful reactions within their bodies, often only realizing the extent of the damage once it has become significant. Make informed choices, practice mindful eating, and consistently combine your fruit with protein or healthy fats whenever feasible. We invite you to consider whether you may have been inadvertently consuming these potentially hazardous fruits, unaware of the concealed dangers they may pose. What was the most surprising revelation for you in this video? Have you noticed any atypical responses after consuming specific fruits that could now be clarified? We invite you to contribute your insights and inquiries in the comments section below. Our dedication lies in uncovering the realities of what is truly occurring within your body. Thank you for watching. Be sure to stay tuned for our upcoming eye-opening revelation regarding everyday foods that may be compromising your health.